When people have nasal obstruction, it's usually due to an inflammatory problem inside of their nose or an anatomy problem. And the inflammatory problems are typically generated by a problem in the sinuses, usually infection or some sort of just native inflammatory problem in the sinus mucosa, or an inflammatory problem inside of the nose, like allergic rhinitis, non-allergic rhinitis, or some sort of chemical exposure, or inflammation pouring out of the sinuses and coming into the nose. When you have an anatomy problem that's creating nasal blockage, it's usually something that someone was born with or the result of some sort of trauma. The anatomy issues are things like a septal deviation, enlarged nasal turbinates, or collapsing internal nasal valves. If you're going to take someone to surgery to try to completely resolve their sinus or nasal issue, you really need to do a good job on the front end of trying to diagnose all of the problems. If you go to surgery because someone has nasal obstruction and they clearly have chronic sinusitis, and the only issue that you address is the chronic sinusitis, you may leave untreated certain problems that exist inside of the nose, like an anatomy issue, like a septal deviation, like turbinate hypertrophy, like a nasal valve problem. So in order to get the best result, you need to treat all of those problems at the same time, including, so in addition to doing the sinus surgery, you may need to do a septoplasty, you may need to do a turbinoplasty, or you may need to do an internal nasal valve reconstruction surgery to give them the best result.